Today, I am at the hospital where I will perform a surgery in collaboration with my colleagues on a 12-year-old girl who has a congenital disease called dystonia. Dystonia is a condition that affects movement and disrupts the coordination of the muscles. It can gradually progress and lead to what is commonly referred to as disability, which can seriously affect walking and the movements of the arms and legs. Therefore, we can perform a surgery that has been done for several years now, aiming to restore these movements to a better state. While it may not return to 100% normal, it can significantly help the patient improve by about 80%. We hope to carry out this surgery today for the girl, which involves connecting a series of microchips or electrodes, wires, and cables to the brain. These will change the brain's function from an abnormal state to a normal one by passing electricity through them. Therefore, this system that we are implanting in the brain involves 2 electrodes that will be placed in the brain, and these will be connected to a battery that provides them with energy. The battery is usually placed in the chest area, above the chest, under the skin. Overall, this system is active for 24 hours and gradually introduces electricity to the brain. As I mentioned, the brain's function changes, but this does not happen immediately after the surgery. The body and brain need to adapt to the electricity, which usually takes several days to weeks for the brain to adjust properly. This allows the muscles to gradually function better and improve their control, enabling them to perform the tasks they need to do. Unfortunately, at present, those muscles cannot perform their required functions, and the patient cannot use their commands properly. I hope this surgery goes well and the patient improves.
The patient who is scheduled to undergo surgery in this operating room today is a young individual suffering from a condition called dystonia, which is a type of movement disorder. This movement disorder causes the muscles to contract simultaneously, resulting in twisting and rotational movements. In the long term, it may lead to permanent damage and deformities in the skeletal system of the patient. In the first stage, a frame is attached to the patient's head, which is actually our guiding tool in the patient's brain. Specialized and advanced imaging will be performed along with a frame, and finally, using this imaging information and the facilities provided by the frame, we will precisely place the electrodes at a point in the brain that is one of the deep brain nuclei. Ultimately, after the surgery, with the planning that the esteemed Dr. Hoviu will carry out in about 1 or 2 weeks, deep brain stimulation will begin with the implanted device, and hopefully within a few months, the therapeutic effects of this deep stimulation will manifest as clinical improvement in the patient.